Foster Friday Live. We are so glad that you are joining us. As you tune in, I hope that you will just let us know that you are here, and I think that you are going to have lots of questions for our guest today, Rachel. We are so glad to have her. Rachel is a nurse educator. Hey, Christy. A nurse educator at Lander University, so she works with nursing students. You have a long career in nursing and in healthcare and working in emergency rooms and all kinds of things. So if you just want to introduce yourself to everyone, and you also are a foster parent.
Yes.
So this is a topic and this is a world that you understand and hopefully can help us navigate.
I am a fairly new foster parent. I'm not quite at my 2-year mark yet, but I do have a little bit of experience there. I have a 3-year-old son named Jack, and then I have a foster son who is actually my very first placement that we're working on adopting, so we're excited about that. But I just hope today I can help clear up some things about navigating healthcare for foster children.
Because there's so much confusion.
Yes.
And it seems like things keep changing,
and it's hard for foster parents who don't have any healthcare background to know how to, go through the healthcare system with insurance and with records and all the different things that you have to know to support a child's healthcare.
I mean, because the kids are coming in and, you have to take them to the doctor, but you have no idea. You hopefully have your foster parent agreement that has their name and their birthday on it, but that really might be it.
Yeah.
So we know that children are coming into foster care with some significant, or at least some type of health issue, some type of concern. So what are some of the most common health issues that children are coming into foster care with?
So many foster care children come in with at least one physical health problem.
Mm-hmm.
That might be something more mild as like an allergy, or it could be complex like a chronic condition.
Mm-hmm.
The unfortunate thing about children that are coming into foster care is their conditions may have never even been diagnosed yet, or even if they have, they may have been left untreated because of neglect, or even the family might have had lack of access to health care, financially or transport or things like that. Yeah. But in addition to physical health problems, many foster children will have dental issues. Sometimes even, I think I saw a statistic, 20% even have like a significant dental problem that's going to take multiple visits and things. There are also psychiatric issues, and that's something that we're seeing more and more in foster care, which some of that has to do with awareness. We're more aware of that at this point. And then there may be some skin things that could be just a dermatitis, like from coming in contact with something that irritated them. It could even be like insect bites from poor living conditions.
We've seen that a lot.
Yeah.
Like lots of bug bites. I feel like our kids that we have had in our home come with lots of bruises.
Mm-hmm.
And sometimes they're just normal kid bruises that you see, on their knees. But sometimes they're like bigger, or they're in different spots.
So another thing that some foster parents will see is some healing of physical abuse or sexual abuse, and that's something that will have to be dealt with as well. It may just be something as simple as the child needs a bath, running water, proper nutrition, a safe place to sleep. So a lot of health-related issues can be cleared up just by the child coming into foster care.
Yeah, and having that safe, stable environment. I know one thing for us is that we're bringing our kids to the doctor, within that first week, and they have not had any immunizations.
Right.
So how do you navigate that? The healthcare system as a whole is confusing. We know that.
Right.
And as we're trying to navigate that for our children in foster care, talk to us a little bit about how foster parents can do a good job of navigating the system well, understanding the Medicaid, understanding the healthcare, how, just what we should do?
The first thing a foster parent should do when they know that they're going to be receiving a placement, before they actually receive the child and the caseworker is gone, they need to make sure they ask about allergies, any health-related issues, any developmental issues, toileting. Now, I'll share an example about that in a second. Also, any medications that the child may have already been on, which a lot of times those don't come with the child, so the foster parent will have to work through that. But those are major things to get answered right away so that you can start the process. I remember when I had a placement of a 4-year-old, I just assumed they would, be in a certain size pull-up, but the child was actually much bigger than I thought. So kind of sorting through those things even before the child gets to your home. There is a document or a packet called the Passport for Health and Education, which is something that should come with a foster child. If it does not, you want to ask for that. Yeah, you definitely want to ask for that. I actually have one here that I can show you what it looks like.
Yeah.
So that passport will oftentimes have a lot of different medical history in there. Hey. And a lot of times the immunization record will be attached to that passport.
If they get
the passport. Now, of course, the information in the passport is just what's been made available to DSS. So they may not have everything. They might not have anything yet, but it's definitely something to ask for. If the immunization record is not attached, that is something the caseworker can request through the local health department. So any immunizations that child has would be housed there on a health department record, and that's something that you want to make sure you ask for.
And now I know that recently it is the new system called Epic. Is that what it's called, where records can be shared a little bit more easily?
That is the prominent electronic documentation system now, but not every healthcare system uses it.
Okay.
The larger ones do for the most part. But yes, we are entering a time where things will be easier to access, but the foster parents still won't be able to do that. They'll have to work with the caseworker for that.
Okay.
One big piece of advice I have, when you go to appointments for dental, for health-related issues, you have to have that foster parent contract, because the office is not going to allow you to do anything for the child medically related without that foster parent contract. Some other things that you'll need when you go to a visit are like a social security number, date of birth, and any Medicaid or other insurance card that they might have. I will tell you that usually doesn't come with the child, so it's something you want to work on from day one, getting that in your possession.
So now, I think a lot of times, I don't think we've ever gotten a social security number for any of our children. That Medicaid card comes weeks later.
Right.
So how might a foster parent navigate that very first appointment they have to take a child to if all they have is name and birthday? They don't even know their allergies.
When they go to the appointment, they will fill out the new client paperwork, and just explain to the staff that this is all you have. It is a foster child, but typically you will have to have the contract at minimum for you to be able to receive services. If you don't have a social security number yet, it is going to make it more challenging, but I think that they would still see the child. But that is something that the caseworker should be able to get fairly quickly, even if it's not the card itself, the actual number. So same thing with the Medicaid. Even if you don't have the card in your possession, you can go ahead and get their Medicaid number and take that to every visit with you.
Okay. Well, and I think that's so interesting that you said, make sure to ask for allergies before they left. I've never thought to do that. That seems so obvious, but I know I was talking to another foster parent, and the caseworker said the child was allergic to chocolate, but the child was saying, no, I'm not allergic to chocolate. Like, I can have chocolate. I'm not allergic to chocolate, which obviously she just wanted chocolate. But, I mean, and it turned out she wasn't actually allergic to chocolate. But, I mean, thinking about things like that, like, you know, wanting to comfort a child when they come into your home and, like, giving them some chocolate or something might seem really innocent. But if you don't know that they have an allergy, that could turn out really badly.
It could. And there are a lot of allergens, even pets. Maybe in their previous home there were no pets, but now you have a dog in your foster home.
Yeah.
You would have to look for signs like itching, watery eyes, runny nose, things like that, that could alert you that there's something in your home that the child hadn't been exposed to before.
Yeah,
that's an allergen
that's
for
a
them.
great point. So now, as we've talked about kind of navigating the healthcare system, what are some of the most common challenges foster parents face as they are trying to care for these children that might have some minor or significant health concerns?
So one thing is the medical records,
Right.
which we kind of touched on already. And again, you just really have to ask for those things and make sure you get them in your possession. What I do for my foster children is just keep a folder for each one. That's kind of what I have here. And as I collect that information, I just keep it all together. Another challenge is our inexperience as foster parents with the issues that the children come with.
Right.
So like for me, if it's anything like a physical problem, like a rash or a wound, I'm good with that because I do have the nursing background. But when it's a developmental delay or maybe even a mental health issue, I'm lacking experience there. So I would definitely recommend leaning on resources, Foster Parent Association, organizations like Care to Foster, where you can get in contact with people who have had more experience.
Because when you don't know, like, you don't even know what you don't know.
Right,
like,
exactly.
And that can begin to feel overwhelming. Yeah. So, for new foster families or, you know, families that are just considering getting started, what are some of the things that you might encourage them to do as they prepare? What advice might you have for them in terms of caring for these health or medical issues?
I have some recommendations both from my nursing background and from my experience as a foster parent. One thing that's going to be important to do before you ever even know you're getting a placement, so probably like once you get your license, go ahead and find the pediatrician and the dentist, because you've got to, number one, make sure they're going to accept your foster child.
Yeah.
And number two, make sure they do file Medicaid. That's going to be huge.
Yeah.
There are places that will not file Medicaid, so you're not going to be able to use that as your healthcare facility. So kind of, even though you can't fill out the paperwork, you can kind of have an understanding with the place
know that they're going
to do it.
And I found that some places are just more foster friendly than others. And I think that goes back to finding that community, the Foster Parent Association or local foster parents that you could kind of say, you know, what do you use?
Like, we're lucky because in our Foster Parent Association, we have a pediatrician who's also a foster parent.
Which, I mean, is huge. I mean, I can't imagine not having that, because she understands the experience of the foster parent. She understands the issues that children are coming into care with. And she also knows where to refer you to, because she works with so many children that are coming in through foster care. And
even if you don't have a pediatrician in your foster parent association or in your community, a lot of times the pediatrician that sees your bio kids will be glad to take on your foster child, or the people that you're in contact with can give you recommendations on where to go if you don't know.
Yeah, because I know, because we started, you know, we didn't have any bio kids. We had never had to find a pediatrician before. That was totally new. And so then all of a sudden these 3 kids are in our house. We've got to take them to the doctor. And it is hard to be a new patient, you know, because the waiting list sometimes is so long. Do you have any advice, like, you know, how to expedite that process? I mean, is it just finding someone in advance that's willing to work with you?
I would recommend going ahead and finding the place as far in advance as possible.
Yeah.
And I don't know if I'm the best one to ask about the next part, because sometimes you do have to be kind of demanding almost.
Yeah.
You know, not rude or anything, but just
Upfront. Yeah.
explain the situation and ask them to understand, you know, this is not the traditional, you've seen the child since birth, but could you be their provider?
Yeah.
Um,
Because you also want to find someone that is going to be understanding it, because unfortunately when they ask questions, most of the time the answer is, I don't know.
right.
Do they have allergies? I don't think so,
That's
but
right.
I don't know. Do they have previous surgeries? I don't know.
Which, from as a healthcare provider, I have a total understanding of that, because when I need to take care of a patient and they don't know their medical history or their medicines or allergies, it can be frustrating and difficult. So I totally understand that side of it. But on the foster parent side, you don't have what you don't have.
There's nothing you can do.
Yeah.
So anything else that you might say to new foster parents in terms of getting ready?
Yes. Other big advice, go ahead and have your stock of over-the-counter medicines ready, because you don't know what's coming. So children's Tylenol and Motrin. You need to have some Benadryl. You need to have some good lotion for that dry, itchy skin. A very gentle soap, because you don't know that your foster child can tolerate, you know, scented soaps or things like that.
Yeah.
And then I do also recommend going ahead and starting a little stock of diapers, pull-ups, overnights, because you may get a child with not much notice that does need to wear those things.
Even if it's an age that you wouldn't typically expect.
Right, exactly.
Yeah.
That's the thing that will trip you up, because you may think a 5-year-old is potty trained, but they're not.
Yes, been there. Yeah.
And, you know, as foster parents, we don't have a traditional baby shower thing. So that is something you could ask for from your coworkers or your friends, like a diaper shower. But just make sure to say, like, we need a variety of things, like pull-ups and overnights and things
I
like
think,
that.
too, like, wipes, like, you're going to need wipes no matter what age your kid is. Like, or, like, cleaning products.
Yes.
Lysol, so, like, that's a good point,
like
you know, thinking about, like, non-scented lotions, you know, the laundry detergent and all of that. You never know when your kid is going to be sensitive, something like that. So that's great advice. But well, thank you, Rachel. And any last words of advice for people? Well, one thing we were talking about, and we're just going to mention this really quickly, was the new secondary consenter.
Yes.
So, like, in just a few sentences, can you kind of wrap that up? And some people maybe have heard of that already from your caseworker. If not, it's being rolled out. Like, don't worry if you haven't heard about this yet, because it's coming. So
there have always been DSS policies on medical care, like how to consent for care for foster children. But there is a new policy that, as she said, is rolling out. It's specifically for routine medical care and when a child needs to be prescribed psychotropic medications, which is for mental health disorders. And so kind of the basics of that is the caseworker is always going to be the primary consenter.
So this is the child's caseworker.
Right.
Okay, from DSS, even if you're with a private,
that's right.
Even if the family's with a private licensing agency, this is the child's caseworker from DSS.
And so if they are able to make decisions and things, they are the primary, but a lot of times the foster parent becomes the secondary consenter, because we are the ones handling the routine stuff. But just know that routine medical care does not include like surgeries, anesthesia, and things like that. So as a foster parent, that's something you would have to take back to the primary consenter. And just kind of as a side note, so you don't get surprised or anything, caseworkers are supposed to consult the bio parents when it's appropriate. So that's just something you may see come up as a foster parent, is some communications and things with the bio parents on medical type issues.
Right, which makes sense because they are the ones that know the medical history and they've, you know, understand the family history as well. So,
and there are some trainings and certificates that go along with that new policy. So for foster parents, if you haven't done that yet, that should be coming to you.
Well, thank you so much, Rachel. I really appreciate it.
Thank you
and thank
for
you
having
all
me.
for tuning in. We hope to see you next week. Bye.